Go ahead and call to order the Student Affairs Committee meeting. Thank you for all of you for getting here bright and early this morning. Yes, sir.
Madam Chair, thank you. Just a real quick housekeeping chore. Mikey has reminded me, and we'll kind of remind everybody throughout the day, that while these mics are fairly sensitive, and we had some of that yesterday, you need to lean forward to the mic because we're not getting it captured on sound. So small housekeeping chore, but if I need to needle people throughout the meeting, I'll do it. I hope you understand.
We appreciate that, Chancellor. Mikey, if you would please call the roll.
Just
Here.
Great. Thank you very much, everyone. I would entertain a motion for approval of our minutes from our June 18th committee meeting. Any questions or comments? All in favor? Aye. Opposed? Motion carries. We have two public regulations for public notice that we need to cover, and this morning we have a really interesting and full agenda. I think just to set the tone for the discussion, we have some big issues, some complicated issues, and I think the committee has a lot of opportunity to decide how much we want to engage in these issues and or not, because hearing kind of from where the universities are that it's kind of one of those things that locally it's being handled and we don't need to engage. But we do have a couple ordinances that we need to, regulations that we need to go through. The first one is Board Regulation 6.011 on the student ombudsman. I can't talk this morning, sorry. Anyhow, this language is straightforward language that calls on each university to establish and maintain a student I can't say that word today. Why am I having a hard time? Haven't had my coffee yet. Function to provide assistance to students in problem solving and conflict resolution. My understanding is, and Vicki has been engaged with them, there really is not any real questions or dissent on this one. It's pretty straightforward, and that Vicki has been working with all the student body presidents. So does anybody have any questions on this regulation? If not, I'd entertain a motion for approval. Okay. Any discussion? All in favor? Great. Opposed? Motion carries. Our second one is a little bit more complicated, and it relates to the student governments. And Vicki has been working very closely with them, so I thought it might be best that she kind of walk us through the issues and the thinking at this point on how to deal with this regulation.
Thank you, Madam Chair. We have been working closely with student government, the vice presidents of student affairs, and general counsels on this regulation that is new and it relates to student governments. It was initially noticed in June, but at that time, as you know, many of our student government presidents may not have been on campus, and we felt like for the need for further transparency and collaboration on this issue, we met with them in August. I had an additional meeting with the USF student government president last evening, and Mr. Barnes, and they brought one suggested change to the regulation that I would like to explain so that when we notice it after this meeting, if it's approved, this change could be reflected. And this relates to the Board of Trustees or its designee approving the internal procedures of student governments. As they pointed out, at every student government association on the 11 campuses, the internal procedures are going to differ. They may be even called by different names, and they felt it was important that the Board of Trustees had the flexibility to approve those internal procedures that it or its designee felt were appropriate to be approved by the board or the board's designee. So we have revised the language in paragraph 5, which is in your packet, to read, upon adoption, such internal procedures shall be approved by the university board or of trustees or its designee as deemed appropriate. And that's the only change to this.
I think that makes a lot of sense. Does anyone have any questions for Vicki? Is there a motion to approve as amended? Is there a second?
Second.
Thank you. Any further discussion? All in favor? Opposed? Motion carries. Thank you. And did not get to recognize, I think we have a few of our student body presidents in the audience. We always love having the student body or representatives from our campuses here. So any of you guys can stand up. I think FSU, FIU, was there any other ones here yet this morning? Particularly noted for an 8:30 meeting. Thank you, gentlemen. Now, we have an issue that we had a presentation in Orlando on about the excessive alcohol use on campus. Again, I think we kind of tasked the council with the student affairs vice presidents to go back and kind of come back with some more ideas and a work plan for us on how we might tackle that. And so I'd like to call on Ms. Ellen Snelling, who is the co-chair of the Tampa Alcohol Coalition, who's going to first talk to us about one of the initiatives happening here in this area.
Good morning, everyone. It's nice to see you here early in the morning, 8:30. I really appreciate being, and I'm very honored to be asked to come here. Dr. Kent from the Vice President of Student Affairs here at University of South Florida is a member of our coalition, and he asked me to speak a little bit about some of the things that we are doing here in the community, working with the university. And we started in about 2002 with a committee of about 5 people. We were very concerned about underage drinking, particularly in an area called Ybor City. Some of you may be familiar with that. And we have grown to over 100 members and very broad representation in the community, including the university, schools, parents, businesses. We work with Pepin Distributing. We work with the courts, Mothers Against Drunk Driving. So I think it's important to have a broad representation and to work with the universities. And I'd like to also acknowledge that we have Maureen Miller and Tom Hall here. We've been active in the Florida Higher Education Committee Against Substance Abuse, and we've been working with them for many years and collaborating across the state. The University of South Florida sends representatives, several of them, to our coalition meetings, and they're going to be starting up a new coalition within the university, and our community coalition will go to their meeting. I think there's mutual benefits for the university as well as the community when you work closely with the university in order to reduce college drinking. And some of the things the university has provided for us is research on excessive drinking and binge drinking on campus, as well as they have helped us do a community assessments on substance abuse within our whole community. They provided us expert speakers. There's a marketing class right now at USF, and they're an advanced marketing class, and they're working with our coalition to provide us marketing techniques, and they're going to provide PSAs and a campaign to reduce underage drinking within the 18 to 27-year-old age group. What we do for the universities is that we help provide grant funding for them, and there's a couple of grants working right now with the University of South Florida as one of our partners. And we provide, I'm known as the data person, and if anyone needs any kind of data within the community, especially on DUI or underage arrest and that type of thing, then they will come to me. A collaboration that we've worked on, one of the things that we do is we have a member who looks at Facebook, and they will monitor it, and they will find things that may be associated with, say, University of South Florida house party that may be going on, not within the university, but right outside. One of the things that happened very recently was there was a party promoter, which is a person who works with the bars and clubs, and they arranged for a party bus to come to the University of South Florida. And this was all on Facebook. So with this information, one of our members went to the USF Police Department and Department of Alcoholic Beverage, and they were able to intercept the bus, and they found that it wasn't just a safe ride. There was actually underage drinking going on in the bus, and there was adults providing alcohol to underage persons, and so there was a number of arrests made. And then what happens is we also share this information, the law enforcement shares it with the university. So that's just one example of the kind of thing that we do to collaborate. Another thing that we did was there was a particular type of bar that wanted to come in right basically across the street from University of South Florida. And we were able to do some research on, they actually first started in Orlando, and we got information from Orlando about their calls for service. We looked at their website. They had all kinds of really interesting pictures of the activities that go on within their bar, and they posted it right on their website and put the name on it. So we presented this information to City Council. Dr. Kevin Banks at University of South Florida went and testified. We had law enforcement, the mayor of Temple Terrace, and we were able to stop a college bar from opening right across the street from USF. So that's how, just the coalition can't really accomplish as many things, but we're working with the university that there's a lot that can be done. And as you know, college drinking doesn't just occur on campus. A lot of it occurs out in the community. So I think that universities really have to work with their coalition if they want to make a dent in underage drinking. I'm very glad that the Board of Governors has chosen excessive drinking as one of their topics that they would like to work on, because I feel I have a strong passion for that. We are interested in policy, and 2 bills that we're working on right now with the Brevard County Coalition is, one of them, it would give extra sanctions to a person who sells alcoholic beverage to a person under the age of 21 2 times within 1 year. There's going to be an extra sanction. It'll go from a second-degree misdemeanor to a first-degree misdemeanor. And the other bill will address open house parties. And an open house party is where an adult is in control of a household or an apartment, and they allow underage drinking to go on. And if a young person under the age of 21 leaves there, has a car crash, and there's serious bodily injury or fatality, then right now it's considered a second-degree misdemeanor, which is a very low penalty. And this bill would make this a third-degree felony. And we feel like the community, parents, adults, law enforcement, state attorney's office, everyone would take it more seriously, and perhaps prevent some of these open house parties that result in fatalities. And that's pretty much, I just wanted to speak for just a few minutes. I don't know if anyone has any questions, but I would just like to say that I know some of the universities and community coalitions have very strong associations right now all across the state, but some do not. I think sometimes the university tends to want to keep their coalition within the university, and there's really only so much you can do in that case. And I feel like if you reach out to your community, there's so much benefit for the community coalition from the university and for us to give back to the university. And I know right now with all the budget crunches, I'm sure everyone would welcome a possible, to be included in on a grant. And coalition grants are doing pretty well right now, and we like to include our university partners in these grants.
Great. Thank you very much.
Thank you very much.
We're going to hear from Dr. Ehas, and so I don't know from the committee, are you able to stay for her presentation so that maybe we could ask questions after we hear that? If we have them for either one of you, that might be a good way to approach it. Again, just as a reminder, Dr. Ehas has talked with us a number of times as the Student Affairs Vice President from UCF, for Student Development and Enrollment Services, sorry. And that we had really challenged them to come back to, is there an action item or a policy or something that they would like us to consider or put into our legislative priorities. So she has a presentation and some thoughts that she wants to provide us today for that.
Thank you very much. Good morning, everyone. Thank you for the opportunity to continue the discussion on excessive alcohol use by students in the SUS that we began at your meeting at UCF this past June. On behalf of the SUS Council of Student Affairs Vice Presidents, I am pleased to present to you our comprehensive work plan to address the problems of excessive drinking on SUS campuses for your review and action.
And I believe this is in your green packet.
Yes, it is. It's a long 8.5 by 14 sheet. In your packets, you also have a copy of the proposed work plan with identified deliverables and target dates that addresses a comprehensive approach to tackling this problem. There are 5 main aspects to our plan. The first is to raise awareness of alcohol abuse issues. We began this process at our last meeting in June when we identified the many contributing factors in both the campus and the off-campus community environment that support excessive drinking and underage drinking that result in negative student behaviors. Second, we propose to collect the most current research and statistics, and we will do that with the help of the Florida Higher Education Alliance for Substance Abuse Prevention and their current president and their president-elect, Tom Hall and Maureen Miller, were already introduced this morning. Third, we propose to inventory the SUS best practices on alcohol use prevention and intervention, and I'll come back to that in the next slide. Four, we propose to focus on Florida law and local ordinances, a critical component of environmental management, a need for action, especially to regulate off-campus activity. Fifth, we propose to strengthen the SUS campus and community coalitions, just as Ms. Snelling here has described. The next slide is a summary. Also in your handout, you have a chart that inventories the many approaches that all 11 SUS institutions use to reduce excessive alcohol use. There are 7 areas that represent best practices. These are, number 1, alcohol-free options. This refers to events and activities, service and volunteer opportunities that provide an alternative to drinking for college students. The second is normative environment. An example would be social marketing campaigns that challenge the misperception that all students drink. The third refers to alcohol availability. This refers to policies that prohibit or restrict when, where, and how alcohol can be consumed. Fourth has to do with marketing and promotion of alcohol. Fifth, policy development and enforcement. Sixth, health protection. This refers to designating staff and supporting offices specifically to address alcohol education, prevention, and other activities with students, faculty, and parents. We all have this. 7, intervention and treatment. This refers to screening programs, assessments, brief interventions, and referrals. I hope you can see from the chart that we are all doing all of the recommended best practices. Where we fail is in support from the state of Florida in regulating, restricting, requiring, or prohibiting practices that support excessive drinking, especially directed to the college-age population, which includes many underage students. Now, this next slide refers to some specific research that has been conducted on the relationship of the cost of a drink to intoxication. We are most concerned about drink specials, and that's what we ask for you to focus on today, and we need your help with this. A drink special is serving alcohol at a fixed all-you-can-drink basis, such as you can drink all these beers for $5 this evening, or offering an unlimited number of drinks during a certain time for a fixed low price. And I just happen to have with me an advertisement from a local establishment near UCF, and just in 1 week, $1 Miller High Life bottles, ladies in free all night, $1 shots all night, free drinks, beer, and shots till midnight, $3 Coronas free all night, or $3 for a Corona, not free, sorry. This happens all the time. We see this constantly. And research clearly shows that drink specials that offer alcohol for a low cost support these high levels of alcohol consumption. One study shown on this slide has determined that there's a 30% increase, or 30% reduction in intoxication rates for every 10-cent increase in the cost of an alcoholic beverage. Subjects in the study who paid $4.44 were less intoxicated than those who paid $1.81 for the same amount of alcohol. There are many other studies that support these data. In your handouts, there is a matrix that illustrates the types of restrictions on alcoholic drink specials that 36 states have instituted, either by statute or administrative rule. As you can see, Florida has none. You have another handout that provides examples of specific statutes and regulations that prohibit unlimited or all-you-can-drink specials, including the advertisement and promotion of these activities. These are examples from various states across the country. In fact, just this week, the British Medical Association has proposed that there be a national ban on the advertisement of alcohol in England because of the dramatic increase that has occurred there in the incidence of adolescent deaths and other harmful behaviors which they attribute to the excessive advertisement of alcohol. So finally, this is what we propose. We ask for your support in helping us reduce excessive drinking by SUS students. The SUS Council of Student Affairs Vice Presidents strongly and unanimously recommends to you that the Board of Governors endorses in its 2010-2011 legislative agenda the enactment of state laws that prohibit unlimited or all-you-can-drink specials and restrict advertisement of drink specials. We cannot do this alone. We need your support. And we've included in your packet an issues analysis that hopefully will show you what is needed to go forward. And we hope that you will join us in reducing alcohol usage by students in the SUS. I thank you, and now if there are questions or other comments, we'll be glad to try to answer them.
Thank you very much, and I know a lot of your peers are here too, and we do appreciate your time and effort, and that this is a very serious issue. One of the discussion points that I think we really need to look at, and I think the issue on the table, if I'm make sure I got it straight, is does this committee want to recommend for inclusion in our legislative priorities? Is the action we're taking a position that helps to prohibit the unlimited all-you-can-drink specials and restrict the advertisement on drink specials is really the action item before this committee. Let's kind of get any of the questions and things out there, but one thought that I just have for your consideration is that we did get a lot of new information kind of here this morning on different ways, and there's more than one way to skin the cat when we get to our actual legislative platform language, that if the committee is so inclined that we would ask them to come back to our next meeting with a specific written language of how it would go into the legislative proposal, and that one of the issues is are we really suggesting that it is a broad across the state, this is it, or do we want it to be kind of a local option? Right now our local governments don't have the ability to implement these type of laws, and that's really I think at the heart of the issue here. And so do we want to maybe encourage them to give it to be a local option so that it is where Alachua County or Orange County or Seminole County can then go work with their institutions and do that, or is it an across the board kind of thing? And so I think that's going to be one of those issues and things that we need to think through as we get to our final platform. Doctor, you want to? Okay. So any questions for Dr. Ehas or Ms. Snelling from the committee? Mr. Stavros.
Your comments, Madam Chair. I don't know what we can do in that. I know there are laws prohibiting adult clubs near schools. I don't know what we are able to do about telling some facility or some operation that you cannot have all you can drink specials. I think, can we look into that? What are the requirements? What can we do? Do I believe that we should limit our young people from all-you-can-drink specials? Of course. I mean, it's just common sense. It nullifies their ability to study and to perform. But I don't know what we can do as an organization, as a Board of Governors. Okay, well, how do we look into that?
Well, I mean, I think what they've done is looked at several of the state models, you know, the 36 states that have that. And I do think that there is some specific language that we could put into our legislative platform where we work with the legislature and that we are explaining why this one is important. I mean, candidly, you know, the liquor lobby has won on this one. I mean, this isn't new. This isn't the first time this has been discussed. Right. You know, and I think one of the things that when I first met with the student affairs VPs that I really challenged them for is, you know, rather than bringing us very informative and helpful topics, bring ones to us that there is a role the Board of Governors can play in helping, and that having a statewide position or, you know, consensus on would help. And I think that's what they've come back to us with, is us being unanimously in, you know, and saying that they can go say to the legislature as they're working these issues that we are in agreement with this makes sense, this is the right policy, that they feel that will help their the ability for this type of legislation to get through, because without our united front, it just hasn't had the oomph to really combat the liquor lobby.
As a 20-year-old, when I came back from World War II with a wound, the doctor said to me, "Don't drink, don't smoke." I said, "If you tell me that third thing, I'm leaving right now." But actually, for health purposes, I didn't drink or smoke because I had to do that. But
Right.
I understand we have to be at a certain level here and come up with the right decision.
And absolutely, I mean, and I think obviously this is not just a university issue. I mean, you know, this is a demographic issue and a cultural issue that, you know, is pervasive across college students and non-college students. I think from my perspective, the thing that, you know, but we do have the ability to to influence some of the behavior and to take responsible action, and, you know, I think that's where we come out with this. Dr. Hitt.
I think really led by Dr. Ehas and folks who work with her at UCF and some friends in Orange County government. Mayor Rich Crotty and I co-chaired a task force on underage drinking, because this is certainly not just a university problem. If you look at the research, about 2/3 of students say they come to us already drinking, and most of them started in middle school. So it's not a university problem per se, it's an underage drinking problem. And I don't know how effective it's been to date, but the task force came up with some interesting suggestions, one of which is that if you have establishments who are habitual offenders, instead of the threat of shutting them down, which I think courts would be reluctant to do, to just shut a business down, they restrict their hours of operation. And that, of course, hits them in the pocketbook without just, you know, totally devastating them. But I really I think that model is probably a very helpful one, and
Absolutely.
It's something, if you've got good relationships with your county or city government, you may want to pursue.
Absolutely. Yes, Dr. Solano.
I'm sure that you have statistics about the cost of alcohol abuse to the state, and it would seem to me that if we're going to proceed, that would be one way to approach this, is how much it's actually costing the state in terms of law enforcement personnel, providing emergency room services and all those kinds of things. It's really in the best interest of the state to try to get a handle on this.
Great point. And I think it also, we're seeing it's costing our universities and our treatment of substance abuse, that we probably should throw into our talking points that little line of what's happening with those and where they're affecting our budgets directly, in addition to the broader societal costs.
We definitely do have that type of data. We need a sponsor for a legislative action, and I think a sponsor would feel very strongly better about pursuing this if they knew the Board of Governors supported it. And I think that's what we're asking you to do, is to support the lobbying of a legislator to take forward a state statute or regulation request that would allow the state or the local entities, which we cannot do the kind of thing that we're asking to do right now. We are stopped at every way at every place. We need this to open up, and we need it through legislative action.
Absolutely. Yes.
I just want
Yes.
to thank you for the time that you've taken. I was just curious, what kind of student participation did you have in putting this presentation together and doing this research?
Oh, our Alcohol and Other Drug Prevention Office, which was very helpful in putting this together, not only at our campus, but at all the other campuses, all have student peer involvement and students involved in their efforts. So we have a very strong student core. Our own student government president is very much aware of what we're doing and what we're asking for and supportive of it.
One other just comment or possible thought on President Hitt's comment is that it might be worth reaching out to the League of Cities and the Florida Association of Counties and asking at maybe one of their annual meetings if we could run a panel on this and get that kind of out in a broad way of the regulations that they can do rather than us trying to tackle them all one-off on that. And probably ought to look at, especially if we do it down the path of local option, not dictatorial across-the-board implementation, we might be able to seek their addition on their legislative platforms as well. I mean, that would be consistent with their methodology, I think, from their organizations. And that would be a pretty strong coalition if we had the universities, the League of Cities, and the Association of Counties.
I agree.
So,
I agree.
any other questions for any of our... Yes, President Bradshaw.
Thank you. Dr. Ehas, how many of the 11 state university system members offer a venue to sell alcohol to students who are 21 or older?
Let me look on the chart here. Is it 9? I think it's 9. 9 do.
So none of our institutions, we serve alcohol to students or provide
Right.
for them to purchase alcohol if they're 21
Yes.
or older.
The issue about, there's a difference between what we can do and what we can regulate on campus and what happens off campus. And that is really the point of our request, is to be able to use the state legislative process to regulate what occurs off campus in the environment that is, just across the street or within a mile or two radius that really is effectively impacting our
No,
students.
I certainly understand that. I guess implied in that is that we don't have a problem with drinking on campus for those students who are 21 or older or abusing alcohol, people who are 21 or older at venues on our campuses that sell alcohol. Is that the implication?
That is the implication. It's not that there is never an issue. The point is that we're there to be able to regulate and set up policies that prohibit that or limit
I
it.
would hope we're not doing the all-you-can-drink specials on
No, we're
campus.
not.
Yeah, I think that's
We're
where
not
the point
doing
is.
that.
Yeah,
We would
just
not
for
be standing here
clarification's
today
sake.
if we did that.
I would ask that question to make a point, and I think in
Yes.
future presentations we should be explicit about that.
Yes, thank you. That's a very good point. Tom Hall wanted to make a comment.
Yes.
I worked on the task force that Dr. Hitt referenced, and one of the things that we found in Orange County was there was a relatively small number of vendors who engage in these kind of practices. And Orange County is a family vacation destination, and so they're committed to having vendors that act responsibly. And unfortunately, there's a group of bar owners and vendors whose business plan is to go after underage and college populations. And so what we're talking isn't about a broad sweeping, but it really narrows down on a number of unscrupulous business owners who target these students in this real important developmental stage in their life.
Okay. Thank you very much. Yes, Governor Stavros.
We're talking about lives here. We're saving lives is really what the intent is. And I have to go on personal experience. My first year back from the war in Colombia, I had a roommate who was a real war hero. Silver Star, Bronze, all kinds of medals. He had a problem with drinking. He didn't spend time studying. He was at the store club or whatever drinking, and many's a night I'd open the door and he'd fall in from drinking so much. Was he brilliant? He was absolutely brilliant. He studied all night before exams and got straight A's. Now, he didn't do anything after college. Because of his drinking, his life was wasted. And I think that's what I'm concerned about. We're talking about the lives of these students, and what the intent is to help them. And so that's really what my concern is, Madam
So
Chair.
is that a motion to have them come back to us with specific language for our consideration at our next meeting to add to our legislative agenda? Yes? Yes. Governor Barnes.
I just had one question. In Dr. Eha's, at the end of it, she said for the 2010-2011 legislative agenda.
I think we're talking about for this coming session in 2010.
This coming session.
Okay, all right.
Yes.
I just want to clarify.
So, right. Any further questions or discussion? So with that, I guess, Gus, was that your motion that we do proceed down the path of getting back the specific language? I think it's important that we not just adopt, we need to get the language, be straight, be clear on it, make sure we're all in agreement at the next meeting. But if the motion can kind of reflect the consensus of the committee is to recommend to the board that we proceed down this path, and we'll take it on as a specific item at the next meeting. Yes.
Madam Chairman,
Yes.
I think one of the things, if we're going to do this, we need to consider is the implementation, starting here in a grassroots effort, of an overall program, university-wide, system-wide, how we're going to, as a united group, take on this issue. Because the first thing is going to come back to us, well, it's fine, you want to do some legislation. What are you doing grassroots? Those questions are going to be asked about on-campus drinking, and those kind of things. So I think we need to, if we're going to do this and be successful, we've got to implement somehow system-wide an ongoing program that means we're going to change drinking habits for university students in the state of Florida.
Well, I mean, I guess they want to respond to you, too, on that one. When you look at the chart we have here of what programs we are already system-wide on and doing, maybe let's encourage them when they come back to us, kind of come back to where we are already in agreement system-wide and doing it before we go too far with how we dictate each community does it, because they all do have different issues with their local governments and different dynamics, and I would hate for anything we do to stop a good program from working, as long as, I think when you look at this chart, you'll see they've got a pretty good basis of consensus and, agreement on doing it. But I agree with your point totally that I think our legislative approach needs to be very comprehensive in here is what we are doing already. We've gone as far as we can go. Here's where we need your help, and I think we can maybe sharpen up that message a little bit as you guys bring it back to us, versus it just being research data backup. Let's build the campaign, so to speak, on how we present it.
I was basically going to say almost the same thing, Madam Chair, and that is that we did a quick review of everything that we're doing so that you could see how comprehensive we all are approaching this topic, and very similarly. But we do have, as part of our work plan, a more extensive review and survey of our approaches that we'll be able to, sharpen our case. So that is part of our plan.
Any other questions? Then I guess Mike, do we need a motion to have them come back with the would that be helpful, just to show you guys we're moving in that direction philosophically? Is that okay? Okay. So is there a second? Second. Any further discussion or questions? All in favor? Aye. Opposed? Motion carries unanimously.
Thank you very much.
Thank you guys for all your work on this. I know this has been a big effort, but I think it is a very important one. So, as if that was not challenging enough, we are going to talk about H1N1 and the bird flu, or the swine flu, I'm sorry. We have got a great panel of experts, and you'll notice we're going to skip an agenda on our insurance thing so that we can move right into this panel discussion, and to make sure that we are all on the same page as to what is happening across our institutions. As I was trying to get my arms around this issue, I kind of framed it, I guess it came down to me, there are several different components to this issue, as there are most of our issues. One, there is the actual treatment of our students and what's happening, but there is also an academic policy issue, when professors maybe say three absences and you fail, and then we're telling them not to come to class if they're sick, that there's some conflicts there. And there's also kind of a business continuity issue of, if we have a lot of students not attending class, what does that do to how we charge them or what happens to their graduation success rates and things of that nature. And so with that in mind, we have this great panel to shed some light on some things for us. Dr. Barkley is the Director of Student Health Center at UF. Mr. David Bujak is the Emergency Management Coordinator for FSU, because I think we'll hear that there's a lot of similarity in how we react to this type of thing compared to a hurricane or another crisis type mode. Dr. Joe Glover, our Provost, and Dr. King, who's also the Provost at West Florida. So the staff did a great job, everybody on the team. Chris Kensley, who has been kind of our point person on disaster recovery, John Rogers, Dottie. This is a big, tough, difficult issue as well. And so I think they've done a great job of bringing a great perspective of ideas and information for us. And with that, you're going to run the panel? I think.
Well, I really am going to do a little update on sort of what the state of affairs are in the state of H1N1 and kind of give a little update on what's going on with H1N1. My name is Phil Barkley. I'm the Director of Student Health at the University of Florida. This is a pandemic, and a pandemic occurs very infrequently across the world, but we are in a pandemic at this point in time, meaning that there is worldwide activity of H1N1 swine flu across the world. It doesn't necessarily describe how severe the disease is, and in fact right now the disease severity has been relatively mild. We view it on a 5-point scale, 5 being the most severe, 1 being the least severe, and right now we're in an approximately a 2 severity level when it comes to this particular disease. There have been a number of pandemics in this century, the most notable being 1918 Spanish influenza, and then the 1957 Asiatic flu. We've had actually some pretty good data of what happened with the Asiatic flu at the University of Florida in 1957. At that point in time, there was estimates of about half the student population being ill at some point in time with the Asiatic flu in 1957. The signs and symptoms of the H1N1 flu syndrome is, I think, a little different than sometimes what the general population thinks of as flu. I think a lot of times the general population believes flu to be nausea, vomiting, and diarrhea. Influenza, which is what we're talking about, is an upper respiratory illness. It's characterized by fever, sore throat, and cough. Usually there's body aches, usually some headache with that. But interestingly enough, with this particular organism, we have been seeing more nausea, vomiting, and diarrhea than we typically see with influenza. This is a flu view map from the Center for Disease Control. Brown is bad, and right now the Southeast is in widespread flu activity, and the state of Florida is in widespread flu activity as well. This is a chart that actually is put out by the Department of Health, and you'll notice that the red bar is actually H1N1, or the number of flu cases that we're seeing in the state of Florida. 3%. We have a set of providers in the state who actually report their cases to the state of Florida, and we have a surveillance network in place to monitor flu activity in Florida. Right now, we're above the 3% activity for moderate activity in the state, and this is as of September 15th. This is also a slide of what the state lab is seeing. Right now, samples are sent to the state lab for evaluation of what organisms are out there. And when the samples are sent, approximately 2/3, 60% to 2/3 of the sample are actually growing flu. And of those samples, 99% of those are H1N1. So when we have flu today, influenza today, it is H1N1 essentially. Through September 15th, there's been 78 deaths in the state of Florida and 709 hospitalizations, and we expect those numbers will continue to rise. Interestingly enough, the attack rate has been most in the 5 to 24-year-old age group, but the death rates have been in the older age groups, specifically 25 to 49 and 50 to 64. Just a little bit about vaccination information. All our campuses are planning for vaccination. The There's more knowns now about what's going to be required for vaccination. It looks like it's going to be a 1 dose for those over the age of 10 and 2 doses for those under the age of 10. The priority groups that's put out for the Center for Disease Control and Vaccination include pregnant women, people who live or care for children under the age of 6 months, healthcare workers and emergency service personnel. And then the big group is the 6-month to 24-year-olds, and that's going to be for us on college campuses a huge response to make sure that our students under the age of 25 are vaccinated, and then 25 to 64-year-olds. So I'll stop there and sit down, and we can begin to discuss.
Great. Well, as they were preparing this panel, the panel was asked to kind of be able to address what has been your institution's experience thus far, and also what do you feel has been your most significant challenge. So, I guess do you guys have any particular order you want to go? Dr. Glover, you want to kick it off? Or?
Maybe we could ask Mr. Bujak to talk about, Dr. Barkley's just talked about the medical aspects. Maybe Mr. Bujak could talk about the logistical aspects, and then Shul and I could discuss the academic aspects.
That'd be great. Thank you.
Thus far at Florida State University, what we have found is that, as Dr. Barkley indicated, all our cases have been mild. We've not sent any students to the hospital. We've not had any fatalities, of course. But the experience at Florida State has been that it has maximized our capacity to address all student health at our Student Health Center. Right now, our Thagard Student Health Center, under the direction of Leslie Satcher, is at full capacity. All appointments are full. Every day we are seeing our maximum capacity of students. To date, we have not sacrificed any of our other health services. However, we're right there at that brink. If we get another surge of H1N1 cases, we have to consider, perhaps postponing or curtailing things like standard physicals or women health services. So really, we're at full capacity right now on our campus. Hopefully, our staff thus far has not been too ill, but that's another one of the risks that we face, is that the health center staff themselves are vulnerable to this, and we could get short-staffed. So right now, I think we say that we're doing well. It has been very sustained. It has been a case rate of about 150 to 160 students per week for the last 4 weeks. And we're at full board. Anything more will hurt. Anything less will be a welcome change.
One question I have for your group, I think, as I understand it, you guys do talk system-wide regularly, but I think this is an important one where we're not all having to learn separately and on our own, and we're leveraging what we're learning. Is that happening regularly?
There was actually a conference call yesterday afternoon led by Dr. Barkley, and I think you'll find that most of the institutions reported, similar trends, and perhaps Dr. Barkley could elaborate.
Regularly meeting.
Closer. Sorry.
We have been regularly meeting every week or every 2 weeks by phone with the health center directors across the state. Some of the privates have joined us as well in those discussions. And we really talk about the campus experience, what is going on in each one of the campuses, as well as what we're doing to respond and what ideas we have to respond. And I think that those connections have been awesome. And I think we've learned from each other. And we've been able to share planning ideas through those discussions.
Great. Good.
Shula, do you want to pick up the academic?
At the University of West Florida.
There you go.
Okay. At the University of West Florida thus far, we've been very fortunate. We've only had 44 incidences of students who have reported the flu-like symptoms. As you may know, the health departments and other areas are no longer testing specifically for this. It's just the assumption, as Dr. Barkley indicated, that if a student or anyone reports these symptoms, that the conclusion is that it's H1N1. Probably the two biggest challenges that we are facing, thus far we have not, one has to do with student residences, because we're at full capacity in our residence halls. And so when a student does become sick who is living in a residence hall, we really have no place to move them or to isolate them. So the things that we're working on to mitigate the impact of that are to quickly respond to make arrangements to have the ill students sent home if that's possible, And if it's not possible to focus, as we have been, on the things that everyone can do to hopefully prevent becoming ill if they have been exposed to it, washing your hands, covering your mouth, that sort of thing. We early on adopted the Center for Disease Control's recommendations, and as those change, we are changing. We worked very quickly in the summer to put information together with the view that this is a serious, a potentially serious virus that will impact our community. We're hoping that all of the steps that we've taken thus far will be just a drill, but we don't know that. On the academic side, as you mentioned, the main concern is the continuity of classes, both for the faculty and the students. And in the summer, I worked with the faculty to get them thinking about what would they do in the event that they were ill, what would they do in the event that a student reported that he or she was unable to take an examination or to complete an assignment. And the faculty have been extremely responsive to this early on in the semester. They spoke with their classes about plans that have been made, about things that might happen in the future, expectations on the part of both the faculty and the students to continue the operations, relaxing the attendance policies, as you indicated, and just being open to this. The main thing that I'm hoping that the faculty don't do is overreact, or the students, or really anybody, because if somebody is sneezing, it could be an allergy or it could be something other than the flu. So to really approach this very cautiously and to do whatever we can to get the information out to the campus community to hopefully mitigate whatever impact is coming our way.
Chancellor Brogan.
I just have a follow-up question on that very issue, because you made a very important point, and that's people's reaction to this. This is a serious issue, and I always recognize if you're going to fall on one side or the other, overreact to something like this, it's safer than underreacting. Having said that, I'm really curious on the larger public policy side that people are just now using an algorithm that suggests that if it waddles like H1N1, quacks like H1N1, therefore it is H1N1. Again, I understand the need and the desire to fall on the side of over-responsibility, if that's such a thing, but I also question if that is, from a public policy perspective, the message that people should be sending. Just to surrender to the fact that anytime anyone has flu-like symptoms, just assume automatically it's H1N1 because of the reaction that people have to the very issue of H1N1 that goes beyond preparation for and recovery from, but just the public relationship that people have to this issue, which is terrifying. So therefore, when Florida Gulf Coast University, to pick on them because I'm looking at President Wilson, announces, based on this algorithm, a number of H1N1 cases, that has a significant reaction in his community, not only the students, the faculty, the staff, but I'm also thinking of the parents of the students who live in New Jersey who hear this large-scale population of students that by designation have been defined as H1N1 victims. And I'm just curious about the public policy side of that decision.
I think it's not just if a student is sneezing or coughing, but if the student goes to the health center and the health professionals who know what to look for are of the opinion that based upon all of the symptoms and all of the information, the student likely has the flu. That's really the population that we're focusing on.
And I appreciate that. I get concerned that if high winds, dark clouds, heavy rain, it's just better to prepare for a hurricane. Because, again, it looks like one. It either is or it isn't. And again, the reaction to all of that, again, I'm not suggesting an underreaction, but from a president's standpoint, local university standpoint, the message that is being sent is there's a hurricane coming because it looks like one. Well, the reaction to that is significant. There is a storm coming, and we're prepared for the storm. And I'm not asking you to solve that issue for me because I know this is a larger issue of public policy. It's just one I think about when I think of these decisions to adopt a formula because so many flu-like symptoms aren't H1N1, and I'm not a practitioner, but I would think that's true, and just to simply adopt a policy that says flu-like symptoms, we're just going to call it H1N1 because it's better to react that way than underreact.
But I think it's important to remember what Dr. Barkley told us a few minutes ago, that 99.9% of the cases out there right now are H1N1.
Yeah, no,
and so actually, this is a good introduction to one or two comments about the logistics involved here, because all of the projections that we've had from the health professionals is that while we're not sure H1 will ramp up in severity, there is a very good possibility that it will. And predictions are that anywhere from 25 to 40% of the student, staff, and faculty population could, at some point in this semester, become ill with H1N1. And so to prepare for that responsibly, we have two considerations. One is we have to respect the policy that students who do get ill need to be afforded the opportunity to make up the work. And the health center directors have indicated that should we experience the upper levels of that influenza outbreak, if we're talking about 30 or 40% of the students getting sick, they cannot handle the volume. They cannot afford to have every student who's sick showing up at the health center. And as a consequence, they are not going to be able to certify that students have H1N1 or are indeed sick. And so the provosts and the deans have been encouraged by all the health directors in the state to assume a flexible posture in dealing with students who do report illness. And so that has been one policy that we, and I believe all the universities, have adopted. It requires constant vigilance. I have no doubt that the Board of Governors members will at various points hear complaints about students. My office fields complaints. Both I and the Ombudsman deal with complaints of students who feel they've not been afforded adequate opportunity to make up work. So we will deal with that. There's no question about that. The bigger question is the question of logistics for us. If you have a class of 1,000 students, which would not be unusual, and 30 or 40% of them get sick, you have to help 300 to 400 students make up the work. That becomes a logistical problem. And so one of the approaches that we've adopted, and I believe it's been adopted by other universities around the state, is that we have installed electronic media in our large lecture halls that will capture the delivery of lectures and lecture material. They'll be put on the web, they're being put on cable TV, and so they will be streamed to students or available for review at any time. This is a help not only to the students in making up the work, but it's also a help to the faculty who need to deal with the logistics of large numbers of students. While this is an immediate response to H1N1, I will point out that this is not a wasted investment of money. This is something that will help our teaching infrastructure in the long run in any case to have the lecture halls equipped in this way. And so we do have that in place. We're actually waiting for H1N1 to ramp up a little bit in severity, which may happen a little bit later this semester. At that point, we're going to flip the switch, and we're going to begin recording all of this electronically and making it available for the students.
What does that do to your budget?
There was an initial investment of not too much money, on the order of, I think it was $150,000 in the software and equipment needed to equip 10 large lecture halls. But as I say, that will be a long-standing investment in infrastructure. And beside that, there is literally no extra cost of money, because it just involves the faculty members and our technology people flipping the switch and recording it and putting it on the web when they're done.
But that's 10 halls. I mean, all the other classes, how do you?
We have targeted all the classrooms that that hold 250 students or more. We could not afford to do this in every classroom at the university. It would be cost prohibitive and just logistically impossible.
But you think then the ability of the professor to deal with the smaller group is easier to handle?
I think if you have a class of 35 to 40, you can make a variety of different types of arrangements to allow students to catch up in their work.
Great. Yes, Governor Martin.
If you're more, what percent is that of your total say, classes?
I couldn't tell you that off the top of my head. As a percentage of classes, it's probably relatively small, but as a percentage of the students who are taught, it's probably fairly significant. I mean, when you consider many of our major freshman classes, biology, chemistry, mathematics, physics, etc., are often taught in that where they have a lecture component in there. You do hit a significant number of students in every academic year that way.
Okay. So in the worst case scenario, then, if you may have 25 to 30% that may have the virus, what is that going to do to the health centers? How are you going to handle that increased traffic coming into your centers?
Let me respond to that. We actually started 2 weeks ago with a little bit of a surge response because we started seeing an uptick in the number of cases. And one of the things that we did was we actually suspended actually ended up being for 1 week, routine physicals, and took those resources to respond to ill students, and that actually worked. There are lots of other things that we can do, extending hours, moving into weekends. The obvious question is, if we have a significant increase in the number of cases, will we have the providers to manage increasing hours if we have more ill providers? And that's a part of the equation that we just don't know the answer to, but there are ways that we can respond. But a couple of pieces of good news. One is that the vast majority of healthy adults can manage this without seeing a healthcare provider. They can take care of themselves at home. We want them to isolate for 24 hours after the fever resolves. They can use Tylenol or ibuprofen for fever control. And because the disease severity at this point in time has been relatively low, we believe that the vast majority of otherwise healthy adults can manage this fine without seeing a healthcare provider. There's no guidance needed. There's no guidance for routine testing, so we don't need to do that. And the use of antiviral agents has been there's been recommendations from the federal government, from the CDC, on less use of antivirals in otherwise healthy adults. So for the vast majority of people who are ill, they can manage themselves fine without seeing a healthcare provider.
Okay. Yes, Dr. Swana.
One of the things that I've noted is that the bulk of our faculty and staff are not in the age range where we are in that priority group to get the H1N1 vaccine. So I think that's a little bit of a problem if I go to my local Walgreens and they'll turn me away because I'm not in that priority category. Yet I'm in an environment with a lot of people who are likely to be getting H1N1. And then my second observation, I'm struck by a lot of what has been provided to us as faculty is how we will soldier on in order and provide continuity of instruction and for our staff continuity of services to help students who fall behind. When we get sick, the flip side of the coin, I'm not going to feel like soldiering on.
Well, perhaps not individually, faculty may not be expected to soldier on, but at an administrative level, departments are expected to. And so, for example, in our College of Business, they've instituted a plan that is 3 faculty deep. So if one faculty member gets sick, the second one fills in. If the second one gets sick, the third one fills in. In the large lectures, there are typically multiple faculty who are delivering them, and so you only need one well faculty member to record a lecture to make sure that continuity continues. I agree that in small classes that are individual of 20 to 30, I think we need to deal with this as we can.
One other kind of question related, I know, Dr. Glover, you shared a memo that I thought was very articulate, and the tone was great, and it was comprehensive. Is that, like, when you send something like that out, are you sharing it with your fellow provosts and stuff, too, so that, again, y'all are kind of learning the comprehensive nature of how each institution is doing that?
Well, typically, I've been sharing with the board staff so
Okay.
that they can disseminate this if they need to.
Okay, and I guess that kind of comes to another comment and/or question that I heard, and I'm guessing the chancellor will jump in on this one. But I think from our side of the world at the Board of Governors, it would be very helpful as you guys are sending those things out and/or engaging in major press announcements of how you're dealing with things to give the board staff the heads up, and make sure that we are leveraging lessons learned, and that as we get questions, you guys aren't getting caught off guard with some new approach to how one of our institutions is dealing with it. I know that the continuity of operation plans require us to deal with all perils, and that this maybe fits into the all perils side of it. One of the questions that I had asked our staff was, is this something that we leave totally at each institution, or is there a statewide policy issue that we have? And I don't know if you want to speak to it, or Chris or anybody, but the feedback we got was maybe that we should have them draft a policy to with regard to these cooperative agreements on health and safety issues. Just so, again, I think you guys are all doing it. I think we'll find that the check marks are there, but just to make sure that if anybody does ask, we do have at least those kind of minimum agreements on what's being in the continuity plans, so that we are all on the same page. Please.
I just have a general sense on these kinds of things that that it is important for this board that has policy setting responsibility and overarching responsibility for the system to have in place general policies that require that people have in place at their own institutional level the appropriate policies and procedures. The cooperative plans is a good example. Everybody here is well on top, I believe, in my heart, because I've worked with you, the H1N1 issue. Everybody here is well on top of the issue of how to prepare for a major catastrophe, hurricane, tornado, or otherwise, because A, you're required to be, based on the requirement to have a COOP plan at the institution level, and I'm confident in that. I think, though, that this is a good illustration of how the Board of Governors needs not only feel that, but be able to say to the broader constituency that we have to be satisfied at this level that you are all doing that. And therefore, not a policy that says, we'll tell you what has to be in your COOP plan. You already know what has to be in there. Not a policy that says you must address H1N1, because that's a part of the COOP plan at the local level, but a policy that says that we must certify forward that we do have our policies in place at the institution level, so that the Board of Governors, the overarching board, has the ability to say that that is satisfied, and that you more than just anecdotally have satisfied that requirement to be able to say to the broader community that that's in place. And it even tracks with issues of underage drinking and binge drinking. I am absolutely sure and comfortable that each of our 11 institutions has in place policies, practices, and procedures to educate, to prevent, and to deal with people who do violate those two issues, underage drinking and binge drinking, at their institutional level. There's another good illustration of, rather than just everybody come forward and anecdotally tell us what your policies are, have the board satisfied by having a policy that states that everyone will have policies, practices, and procedures in place. I'm not trying to create, in my mind, redundancies here, but just as your local boards have a responsibility to more than anecdotally satisfy themselves that you're on top of that issue, even though they know you are, I think this board has the same responsibility, without getting down into the weeds in that policy and telling you how you need to satisfy those obligations. Does that make sense? And there's a fine line there. I understand that.
Governor Roberts.
Just a point about our universities, the health of our student population and our faculty. I want to make a point that this is a very healthy state. It's a great place to live and visit. And though there may be issues with disease, with this disease in our country, we're dealing with it appropriately. We don't want to frighten people when they follow this meeting or read the press about visiting and moving to Florida. We're a healthy, strong state, and we'll deal with it in a way that's appropriate.
And I think I would reiterate what Dr. Barkley has said, which is so far the incidence of H1N1 has been relatively low.
We are healthy.
Dr. Slon.
I guess that's a good segue into my question. Just out of curiosity, from a kind of a public health standpoint, does one tell the faculty and staff any information about how many cases are on their campus? Or I think we've gotten the memos and a little pitch in our faculty senate, but then we haven't heard anything else, so I don't know if we're talking about one student on our campus or 150. So from just that sort of public health, how does one approach that?
At the University of Florida, we made a decision at our task force meeting yesterday that we would go ahead and actually put out on our web the number of cases that we're seeing at the Student Health Care Center. But again, I think that only represents a fraction of probably what we are really dealing with on our campuses. We actually have started a research study to randomly sample 1,500 students each week to try to understand what the overall impact is on the University of Florida campus. And so I think we're going to learn a lot from this particular disease on what really campus activity in a pandemic is. But our decision yesterday was to go ahead and put out publicly how many cases we are seeing at Student Health, understanding that that's not the full picture.
I guess my gut reaction would be that it would be helpful to have that sort of broad information. It helps the faculty and staff take it a little bit more seriously to know that, yeah, this is really here and these are the numbers of people that we're seeing. But not being in that field, I didn't know how one should approach that.
Governor Tripp.
A couple of questions.
Mike.
Do we have any idea how long we think this will last? Do we expect that it won't be over till 100% of everybody gets it? I mean, you know, some of these questions I think are very important in that it was good to alert, you know, the world and then the United States and then Florida about something coming on. But I get a feeling that it could take on a life of its own if we're not realistic about what are your expectations on your campus. I mean, at some point, do you have a feel now of what you really think you're going to see and the timing of it?
Excellent question, and I think that unfortunately we don't know what the future holds. But let me make a couple of comments that I think are pieces of good news. In our conference call yesterday with the Student Health Care Center, we believe that the mitigation efforts that we have suggested for college students, staying home if you're ill, keeping your hands clean, covering your cough and sneeze, is actually made a difference. And so we believe that that has actually, on our college campuses, sort of helped flatten the curve when it comes to the total number of cases that we've seen so far. If we can keep the total number of cases at a relatively stable rate, keeping them low until we can get vaccine, then I think we really can modify this disease. And we're expecting to see vaccine as early as mid to late October. And once we have vaccine, I think we really can modify this overall pandemic, which was not available, as an example, in 1918. And I think that's what the public health effort has been. Let's try to slow the disease right now until we can get vaccine and really change this disease. And hopefully by mid-October we can begin to do that.
And
Phil, is it, if I could, on the vaccine, is it a requirement or is it going to be involuntary? And are we setting up as a system to have in place, you know, the immediate ability to get that? And can we require people to take it as part of the fact that you're a student to be here? So I doubt that we could do that. So kind of voluntary.
So each each institution has been asked to work with their local health department in requesting vaccine and being able to deliver vaccine on the college campuses. So vaccine will flow from the federal government to the Department of Health to the local health departments, and so each one of us are working with our local health departments. If seasonal flu vaccine uptake is any predictor of what we'll see on our college campuses, I think we'll have a significant number of the eligible people requesting vaccine. We've already delivered 2,500 seasonal flu doses on our college campus at University of Florida. It's been much easier this year to already give seasonal flu vaccine. To the public, I doubt, I strongly would not expect that there'll be any requirements for people to actually get vaccinated.
And Phil, is it still believed in the medical community that people born before 1957 have some resistance or immunity?
It's one time in life where it's better to be a little older. The attack rates have been less for those born before 1957, and specifically those born who are older than the age of 65. The attack rates have been much less than those.
Yeah. We got something for
I guess
our age, right.
To Dr. Solano's point, though, is it going to be available to faculty too, or is it really just the students, or how are you dealing with that?
So we will be required to follow the CDC and the Advisory Council on Immunization Practice guidance on who gets vaccine. And right now, the target groups were, as I listed, pregnant women, first responders, healthcare workers, those that take care of children under the age of 6 months, and then children and young adults through the age of 24, because the attack rate has been higher in those particular age groups. Then there'll be an extension of the vaccine for those 25 to 64. Particularly those that have high-risk medical conditions will be the next group that's vaccinated. The great news is that we've learned recently that it looks like it's going to be a one-dose vaccine for those over the age of 10, which means that we originally thought it was going to be a two-dose vaccine, which means that we'll have more doses available for the general population. So I certainly no way to predict this. A lot has to do on how many doses are made available and how well the vaccine manufacturing process occurs. But certainly the news is good in being able to extend vaccine outside of those original age groups.
Good. Well, my 7-year-old won't be happy with that, but we'll, I guess we need to kind of wrap up our discussion. Governor Barnes, do you have a quick comment?
Yeah, I just had a quick question. Something Dr. King touched on. You said earlier that some of the universities, in the case that they have a student who's documented with the H1N1, or I guess the 99.9% certainty that they may have it, that the first recommendation is to try to send those students home. Has there been any cases where the students haven't financially been able to do that, or has there been situations where the university has, whether it be subsidize those costs, or if we get to a point where we're going to set up quarantines for 6 students?
We haven't had to deal with that yet. In terms of, this is just for student residents that I was speaking of. For the students who live off campus, there really isn't anything that we can do in terms of that. So, and in terms of the quarantine, we don't have the room in our residence halls to do that. Probably the best thing that we could do in that situation is to move students around, to pair a sick student with a sick student and a well student with a well student. But one of the implications of this, and Dr. Barkley, you're in a better position than I, but it's my understanding that one is contagious 24 hours before the symptoms actually appear. And so the contagiousness of it, or the transmission, could have already occurred prior to that.
Great. So I think, though, we maybe need a motion to ask the staff to come back to us with a policy that is not micromanaging, but responsible for the cooperative plans to bring for our discussion at our next meeting. Is there
So moved.
Is there a second? Any further discussion or questions? All in favor?
Aye.
Opposed? Motion carries. Thank you very much, all of our panelists. This was very helpful and informative, and we look forward to continued positive updates. If we can, maybe, John, on the insurance task force update, do we want to go ahead and do that real quickly?
Of the Student Health Insurance Task Force, the members are taking their jobs very seriously. They've had 2 conference calls since the summer, gathering research. Their focus is on states that offer a variety of different options to students for coverage as far as how they deliver insurance policies. And they're right now investigating states that are establishing consortiums of both voluntary and mandatory delivery systems for insurance, and I think that's where the task force wants to go with that. We hope to draft a report in the next month or so and have it out for input from our Student Health Center directors, and we'll bring back to the committee the initial draft at its next meeting, which is scheduled for December.
Okay. Have we heard anything much on legislative agendas on this one yet? I mean, is it kind of quiet on this front, or is it?
Well, I can tell you OPAGA is doing a similar study as directed by the legislature. Their report is due in December. We've been communicating with their staff, exchanging information, so we're kind of running in parallel on this topic. And they, as well, will have a draft out probably in November.
Okay, great.
So the legislature is kind of waiting for OPAGA to produce a report.
Okay, wonderful. Dr. Genshaft, I think you have a brief announcement for us on the veterans.
Yes, thank you so much. I will pass out the uniforms to mortarboards flyer. I believe in front of the board members you have a document that came out of American Council on Education and a whole variety of other organizations that are national, from soldier to student. The meeting that we're having on November 6th is really for all different personnel, a whole variety of personnel at each university, because in the morning we'll have some overarching speakers, but the afternoon is going to be broken up into areas so that if you're interested in research on this population, there'll be focus groups on this. If you're interested in admissions and registration and how these veterans come back into the fold, if you're interested in student affairs. So there'll be different kinds of breakout groups. It has been endorsed, and thank you for the support from the Florida Board of Governors, the Independent Colleges and Universities of Florida, the Florida College System, and the Florida Association of Colleges and Universities. And we're very pleased that this is being sponsored by Baycare Life Management. The veteran groups are very, very interested in this. So I would urge all of the presidents and all of the people in the audience to please, please, please register for this conference. It's one that we're very proud to sponsor, but we are just this is a conference for all Florida institutions. We're bringing down national people to do the speaking, so we're going to have speakers nationally, and it should be a very, very dynamic group, and we tried to make it very affordable so that you don't have to stay overnight if you don't want to. And I urge all of the presidents and vice presidents and provosts, please send your groups of people to this conference, because there is really information for everyone.
Great. Thank you very much, and thank you to all the presidents and provosts. I've been reading such great things about what's happening on our campuses related to this issue, and it does appear that Florida is being one of the most proactive and really engaged on this issue, and I think that is wonderful. We are really pressing up against it, John. I don't know if that you have anything really pressing you need to announce, but if you do, we need to probably keep it to 1 minute, or the chair's going to get on me that we're running late. So if you got a couple comments, go for it, but keep them brief, please, and we'll maybe allot some more time at the next meeting.
Thank you, Chair. Just update on FSA. 3 months ago, a movement got underway to reform and reorganize the Florida Student Association. When we convened for our annual planning conference in Orlando in late June, we realized that the manner in which the organization was structured would have to undergo a major overhaul. Very legitimate concerns and issues were raised and are being addressed. In late July, the board opted against renewing the contracts of its executive director and lobbyist and has a graduate student assistant handling FSA's day-to-day activities. Since August, members of FSA's board have been meeting with various professionals in Tallahassee, including 2 former executive directors and those in the fields of lobbying and association management, in order to plot the course for FSA's future. So what does the course look like? With the help of outside advice, FSA has developed a plan of action for 2009-2010 to organize and guide our reforms. The following are some substantive components of that reform. First, the board of directors' decision to outsource the directorship of FSA to a professional association management firm and abandon our old executive director model. FSA's leadership determined that the executive director model was inherently flawed and that hiring an association management firm would address FSA's biggest problems with the old structure. Given that an association management firm has professionalism to provide the organization with the financial accountability it needs, management firms have the ability to provide steady directorship from year to year, and management firms also have extensive experience in the field of nonprofit management. Management firms have a real monetary incentive to perform well and retain their clients from year to year, thus mitigating the principal agent dilemma organizations often feel when searching for a directorship. Second, the FSA will establish robust financial controls. We're going to establish a new dues structure based on cutting extraneous costs and establishing a new tier structure for our dues to accommodate the fiscal needs of all universities while maintaining FSA's goals and strategies. One of our first cuts will be getting rid of our Tallahassee office, which will save us close to $15,000 a year without compromising our greatest priority, lobbying for all the students in the SUS system. We'll also establish new signatories on FSA's bank accounts and develop new expenditure protocols. The association will establish a regular schedule for reporting on finances to FSA's executive board, which will include mandatory monthly financial updates. Third, FSA is moving forward with establishing its 2010 legislative agenda. Components of this agenda include key issues such as bright futures, student health insurance, CITF, equal representation on student fee committees, and setting up a lobbying calendar. Fourth, FSA plans to expand its outreach to its constituents and regularly inform students of FSA activities and the issues that impact them. This includes providing regular updates via the 3 mediums most frequently used by college students: Facebook, Twitter, and YouTube, conducting at least one campus community forum at each semester on our main campuses, and holding, of course, our rally and tally, which will be in March. Finally, FSA will implement a more effective organizational structure. This includes revising FSA's mission, identifying desired long-term outcomes, and organizing the committee structure and responsibilities, identifying funding needs, and revising our bylaws. We are proposing that all 11 student body presidents meet regularly to discuss the issues which affect Florida's public university system, students. Chancellor Brogan has already agreed to meet regularly with all 11 student body presidents beginning next Thursday, October 1st, at FAMU, which all student body presidents have already been invited to. We in FSA are confident that we will continue to provide strong leadership and advocating on behalf of Florida students. Soon, FSA will be meeting to settle some of its key decisions for the future. I'm reminded of a passage from Scripture. I will put this third into the fire and refine them as one refines silver and test them as gold is tested. We believe the crucible of the past 3 months has made our organization stronger and that the reforms that we are undertaking will enhance the effectiveness and longevity of FSA. We look forward to what's in store for the future and are as eager as ever to advocate on behalf of the state's biggest constituencies, Florida students in higher education. Florida's students are Florida's future, and our strength is standing united as one voice, and we are ready as ever to stand as that voice.
Thank you very much, and I think I speak for my fellow board members that we are all here because of the students. That is what it's about, and it is important that we hear from you guys and we stay connected. With that, thank you very much. I think we had a very full agenda. We got a lot accomplished, and we will continue on our path and have another good meeting next board meeting, hopefully. Meeting adjourned.